Hi, I am Dr BinduMenon. I am a neurologist from Apollo Specialty Hospitals, Nellore. Welcome to our stroke prevention campaign where we address one risk factor for stroke every month. May month is dedicated to snoring and obstructive sleep apnea as a risk factor for stroke. Stroke is one of the most important neurological disorders with a high incidence of morbidity and mortality, and snoring is one of the most common sleep breathing disorders. It accounts to around 30% of people having a snoring among the population. What is snoring? Snoring is a vibratory mechanism in the upper respiratory area. It can be due to the increased soft tissue which is obstructing the airways. It could be mild, it could be a normal snoring, it could be mild, moderate or severe. When it is severe, it is called as obstructive sleep apnea. The obstructive sleep apnea gives rise to several other risk factors like hypertension, cardiac disease and atrial fibrillation, which could be a reason for the stroke, or in itself as an individual it can lead to stroke as well. It is very important for people to recognize the obstructive sleep apnea. It is important that people, the spouses or the other family members recognize that in obstructive sleep apnea, when the patient sleeps, there can be brief lapses of breathing, that is apneic spells that can be identified. They are also at increased risk of hypertension. The patients who are overweight, obese, more common in male genders as well. And in some patients, when the atrial fibrillation, that is the irregular pulse rate, is refractory, it is because of, could be because of obstructive sleep apnea. Obstructive sleep apnea produces a lot of autonomic dysfunction, which could be one reason why the patients can be at risk of a brain stroke. Why is it important to understand the obstructive sleep apnea in patients? Because one, if we miss out on that risk factor as a potential reason for a patient to have a stroke, there could be another recurrent stroke in that patient if you do not address that risk factor apart from the conventional risk factors. Secondly, if the patient has obstructive sleep apnea, if the patient develops a stroke, the prognosis of the patient also needs to be addressed, because if the patient has an OSA, the stroke might increase and the person's prognosis varies and can be less. It is very important for us to have a better opportunity to offer better treatment only if you identify the risk factors. Sleep apnea needs to be consulted by a sleep medicine person. There are investigations which can quantify that whether your snoring is mild, moderate, severe, going to an OSA, which can put a person to a risk for a heart as well as a brain stroke. Welcome to our stroke prevention campaign and follow our regular updates. Thank you very much.